As a young citizen of India, armed with technology, knowledge, and love for my nation, with a vision of transforming India into a developed nation, I'm joining Shobhit University. What about you?
Very good morning to all the participants from India and abroad. Shobhit Institute of Engineering and Technology, Meerut, deemed to be university, and its centers of excellence, Center for Informatics Development Solutions and Applications, and Center for Industry 4.0 Technology Studies and Application, in association with African Asian Rural Development Organization, ARDO, New Delhi, organized this weekly international webinar series on open source digital technologies towards self-reliant India, Atmanirbhar Bharat. Today is the 77th edition of this webinar series. On behalf of the Honorable Chancellor, His Excellency the Secretary General ARDO, His Honorable Vice Chancellor, the faculty members of the university, and on my behalf, and as Professor Emeritus and Chairman of Centers of Excellence, Center for Agricultural Informatics and E-Governance Research Studies, Center for Agri-Business and Disaster Management Studies, Center for Informatics Development Solutions and Applications, and Center for Industry 4.0 Technology Studies and Application, and Center for Health Informatics and Computing. Let me welcome our guest speaker of today's webinar, Dr. Praveen Malik. He is the principal scientist with the ICAR National Research Center or Equines and the Animal Husbandry Commissioner, Government of India. Today, he will talk on the very important topic, Health Informatics Network Value Chain National Animal Disease Reporting System, NADRS 2012 and beyond. I wish to inform the participants and the guest speaker that under this international webinar series, these two centers of excellence, CIDSA and CITSA, have organized 76 lectures so far on very important topic, open technologies to provision simple and economical IT infrastructure, a roadmap for students using free and open source software and reaching goals of Atmanirbhar Bharat, open source software and industrial IoTs for SMEs, free and open source and business models, free and open source software adoption and business models, open data platform for smart governance, smart digital government, technology imperatives make in India for self-reliance, edge artificial intelligence, data governance for self-reliant India, Digital India transforming governance and society, India's email, citizen@indiamail.com in 22 constitutionally recognized languages, ecosystem architecture for digital transformation, ecosystem cyber critical infrastructure, seizing opportunities in open innovation, and value creation network in the digital world for self-reliant economy. This talk was given by Dr. Jebamale Vinanji Arachi, former principal advisor to Director General UNIDO. Ensuring food safety and compliance through technology. Digital India, urgent need for semiconductor manufacturing in India. Technology investment in agriculture value chain, role of foreign direct investments. Entrepreneurship and skill development, AI design pathways. Rise of platform economy, revisiting value chain governance. Era of automation, industrial robotics, and Industry 4.0 Indo-German perspective of technology, transfer, skill gap analysis and opportunities. Role of artificial intelligence in healthcare, current developments in diagnosis and vaccine research. Digital agri-tech and agri-startup perspective. Healthcare informatics network value chain, e-health system and beyond. Leveraging emerging technologies for ensuring transparent and traceable agri and food supply chains. Unleash the power of citizen development for enterprise software development. E-governance models towards sustained quality service to citizen backed up by technology. Indian MSMEs to adopt Industry 4.0 technology capabilities, urgent need for mentorship accelerator program. Building public digital platform using microservices and APIs. Health informatics network value chain, early childhood development and learning. Health informatics network value chain, clinical AI, clinical artificial intelligence, interface between machine learning and health informatics. Health informatics network value chain, importance of social medicine and community health in the times of health emergency. G-Filter, a simple low-cost solution to the drinking water treatment in rural India. Open source GovTech startups, empowering growth with automation. Digital transformation in small enterprises and small businesses of India, challenges and opportunities. National Digital Twine Program, need for a robust geospatial infrastructure. It is very important for health informatics network value chain. Industry 4.0 in MSMEs, benefits of indigenously developed CollabCAD software from National Informatics Center. Mass serialization and anti-counterfeiting solutions to fight illicit trade. Cyber security, risk, challenges and solutions. Intelligence approach to reduce cyber risk. New Internet IPv6 root server toward Atmanirbhar Connected Bharat. Indian startups, reflections and possible policy intervention needed for scaling up to Gram Panchayat. Blockchain and crypto for digital assets platform, pathways for global trade. Robot as a service, leverage technology to solve enterprise challenges. Space startups connecting to international markets with business models. Enabling technologies for future vision. Vivekananda Secondary Education and Skill Development Mega Project, its potential impact on rural entrepreneurship and rural economy. Sports Grail, a digital sports media platform and prospects of Indian sports industry sustainability model at global level. Pharma 4.0, Industry 4.0 applications to pharmaceutical manufacturing, path to a digital transformation. Accelerate and scale non-linear growth through partner ecosystem. Technological renaissance and the human capital, a perspective. Health informatics network value chain, medical outreach, challenges and potential. Beyond COVID-19, revitalizing micro and small enterprises. Project management essentials, launchpad for future CEOs and startups, founders beyond. Society 5.0, a new society beyond Industry 4.0 and post-COVID-19. Smart village community, the African ICT/IoT lesson. Digital economy, ways and means to protect and empower self-reliance. Pragmatic base for Atmanirbhar Bharat. Democratization of essential services by using sustainable energy as a catalyst. Transforming India through relevant education and vocational training. Digital technology in simplifying citizen life. Online learning during the pandemic and its future. Smart microeconomic zones, pathway for self-reliance at village level. Crime prediction support system. Knowledge management for development partnership to achieve the sustainable development goals of UN and implementing the Agenda 2030. Millet value chain, from IoT to blockchain, a traceability roadmap. Aspirational district program in left-wing extremism affected district, a successful model of data-driven governance. Digital architect, agriculture supply chain and trading hub, a geo-economic perspective. Market-driven agriculture, need for development of crop-specific strategies at block level. An open agri network to unlock $1 trillion potentials, $1 trillion plus potentials of Indian agriculture with smallholder farmers. An open agri network to unlock the $1 trillion plus potential of Indian agriculture with smallholder farmers. Developing rural entrepreneurship to ensure doubling of farmers' income. Leveraging the power of convergence through connecting the dots, agri startups, agripreneurs, and rural innovators. Agronomy and artificial intelligence equal to precision farming. Doubling farmers' income. Imperative of plant health informatics network. Developing commercial breadfruit value chain to help farmers reach high value market. Commodity value chain creation through agri network and agri AI by Mr. Andrew Gavagan from Melbourne, Australia. Farm to plate, a one-stop agri-tech platform to simplify supply chain and e-commerce needs of food and perishable commodities. Today is the 77th edition of this very important webinar series. We will have the talk by our guest speaker, Dr. Praveen Malik, Principal Scientist, ICAR National Research Center on Equines, Hisar, and the Animal Husbandry Commissioner, and former Director, CCS, National Institute of Animal Health, Department of Animal Husbandry Dairying, and Ministry of Fisheries, Animal Husbandry Dairy. He will talk on the topic Health Informatics Network Value Chain, National Animal Disease Reporting System, NADRS 2012 and beyond. Dear participants, please note the keywords: Health Informatics, Network Value Chain, Animal Disease, National Reporting System, and NADRS. Atmanirbhar Bharat is the road ahead. This is the vision of our Honorable Prime Minister, Shri Narendra Modi, of making India a self-reliant nation rested on 5 I's: intent, investment, inclusion, infrastructure, and innovation rested on 5 pillars: economy, quantum jump in economy; infrastructure, one that represents modern India through PM Prime Minister's Gadi Shakti; infrastructure, one that represents modern India; systems, 21st century technology driven, vibrant demography; and demand, whereby the strength of our demand and supply chain should be utilized to full capacity. And during the third tranche of Atmanirbhar Bharat Abhiyan, agriculture sector got about 1.5 lakh crore as a booster. Rupees 1 lakh crore to agriculture cooperative societies and farmer produce organization and startups for boosting farm gate infrastructure. 10,000 crores for formalization of micro food enterprises and for following cluster-based farming approach. 13,000 crores to achieve 100% vaccination of cattle, buffaloes, sheep, goats, and pigs. 15,000 crores for animal husbandry infrastructure, and 500 crores for beekeeping initiatives. Vocal for local to make it global is the mantra in India. Agriculture sector is the foundation of Indian economy. India lives in village. Acharya Vinoba Bhave said that India is largely an agricultural country, Krishi Pradhan Desh, and a country of villages, Kram Pradhan Desh, having more than 6.25 lakhs villages. Agriculture sector employs more than 50% of India's workforce and contributes almost 19% of its GDP. At present, agricultural livelihoods are being severely impacted world over as a result of anthropogenic global warming and climate change. India's labor-intensive and subsistence-based agriculture sector is particularly vulnerable to this development. Climate-aligned business is the way forward for Indian Inc. According to the report from Council on Energy, Environment and Water's recent climate vulnerability index, as per 2001 census of India, 463 of India's districts, which are home to 968 million people, are extremely vulnerable to climate events. 463 districts. Farmers of India are facing multidimensional problems: price fluctuation, debt, and lack of infrastructure and weather. An Indian farming community consists of about 14.5 crore operational holdings, of which 85% of the farmers are having small and marginal holdings. Farmer needs timely, location-specific, and personalized information for effective control on their production, risk, and then market their produce to identified market opportunities. I would like to quote our Honorable Prime Minister's Independence Day speech, which was given on 15th August 2021, in which he said, I quote, "In the coming years, we will have to increase the collective power of the small farmers of the country. We have to give them new facilities. They must become the country's pride. Chota Kisan Bane Desh Ki Shaan." And India needs market-driven agriculture needed for development of crop-specific strategies at block level, sustainable integration of livestock and agriculture at the grassroots level is very important. And I also would like to quote the recommendation from the Doubling Farmers' Income with respect to the digitalization of agriculture systems. I was closely associated with the two volumes, volume 11, that is empowering the farmers through extension and knowledge dissemination, and volume 12B as digital technology in agriculture as its group leader. The volume 12B talks about 7 mission mode programs for total digitalization of agriculture, under which seventh one is digitalized farm health management to reduce for reduction of farmers' loss. It comprises of farmers' health, means public health, plant health, animal health, soil health, water health, and fish health and environmental health. And 2020-21 budget, Government of India has announced National Institute of One Health to promote One Health program. We have a Digital India program, and which aims to transform India into a knowledge-based economy and a digitalized, empowered society. In the digital technology in agriculture, other 6 mission mode programs are digitalized agriculture. It means synergization of various government programs at grassroots level, be it Digital India, Make in India, Skill India, Stand Up India, and Startup India, to bring in digital, transformational reforms in agriculture sector through smart rainfed farming, smart irrigated farming, and smart tribal farming. Digitalized agromet advisories and agriculture risk management solutions. Digitalized agriculture resources and resources information system and micro level planning, facilitating smart village and smart farming. Digitalized agriculture value chain for more than 400 agriculture commodities. Digitalized access to inputs, technology, knowledge, skill, agricultural finance, credit, marketing, and agribusiness management. Digitalized integrated land and water management system, per drop and more crop. And digitalized world is the rise of platform economy. AI, 5G, IoT, serverless computing, biometrics, augmented reality, virtual reality, blockchain, robotics, natural language processing, and quantum computing are going to rule the digital world. And the metaverse is a parallel universe wherein human, augmented, and virtual realities are supposed to merge to bring in large-scale digital transformation. In India, we have 3 ecosystems: agriculture 4.0, industry 4.0, and society 5.0. Society 5.0 has come from Japan. Industry 4.0 has come from India, and India has to contribute to the whole world agriculture 4.0 and subsequently agriculture 5.0 to achieve society 5.0. And we also have Amrit Kal led up to 100, next 25 years perspective plan, having 4 priorities: Prime Minister's Kadi Shakti, inclusive development, productivity enhancement and investment, sunrise opportunities, energy transition, and climate action and financing of investments. And we have Sustainable Development Goals 17, and also to achieve 169 targets. Leveraging of the power of convergence through connecting the dots, agri startups, including animal husbandry startups, livestock startups, agripreneurs, and rural investment are necessary at the rural level. Value chain brings all the stakeholders engaged in the production system on a common platform to contribute their best while ensuring fair deal and transparency. This is very important for animal husbandry sector. And animal husbandry sector value chain also has to be integrated with the global value chain. Digital platforms are changing who participates in the global value chain. And our Indian Agriculture Export Policy 2018 also talks about that. It is a time that, and also is very imperative to integrate with the global value chain at the earliest. In this context, we will have Health Informatics Network Value Chain, National Animal Disease Reporting System, NADRS 2012, and which I was closely associated when I was in service. And then we will have beyond what has happened after 2012. Digital health platform. Digital health is a multidisciplinary domain involving many stakeholders, including clinicians, researchers, scientists, with a wide range of expertise in healthcare, engineering, social sciences, public health, health economics, and data management. Health informatics network value chain it consists of human health, plant health, and water health, and fish health, and animal health, soil health, and air health. And in this, I took an interest when I was asked to present a paper in the National Agriculture Science Congress held in 10th Agriculture Science Congress held in 2011 at Lucknow. The title of the congress was Soil, Plant, and Animal Health for Enhanced and Sustained Agriculture Productivity. In that conference, I delivered a talk on the need for informatics and databases, and to also have a national center for farm health informatics, system studies. And from that day onwards, I have been working on as to how to establish health informatics network value chain. It will involve application of technologies, artificial intelligence, big data analytics, cloud computing, social network, mobility, Internet of Medical Things, Web of Medical Things, blockchain technology, biological computing, geomatics, informatics, robotics, and nanotechnology, and so on and so forth. And digital health startups are very essential. So in order to work out the health informatics network comprising of, now they say that one health, eco health, human health, plant health, animal health, soil health, water health, fish health, and environment health, each one is working on silos. But if this is connected through a GIS technology on a location specific with the appropriate algorithm, it is a $1 trillion data economy, which India can do wonders. That's why the health informatics network value chain, which has been being promoted, and I'm completely, involved in this one. And that's why the Shobhit Institute of Engineering Technology even established a Center of Excellence, Center for Health Informatics and Computing, to bring in BSc Health Informatics and MSc Health Informatics with the value, artificial intelligence and big data analytics. Database feature is online. Databases, smart cards, and online doctors. The longer a nation waits to embrace the future, whether through private or public system, the less prepared it will be for the next inevitable pandemic. We had enough with the COVID-19. Will the blockchain lead to the next technology renaissance in the health informatics network value chain? National Animal Disease Reporting System 2012. And this was a new centrally sponsored scheme of the Central Department of Animal Husbandry, Dairying and Fisheries, Ministry of Agriculture at that time. This was visualized during 2010 to 2012. And this is the first time after 1987 when the government of India has gone to 512 districts through the District Information System program, in which a satellite-based network called a NICNet and a district information system called DISNIC were operationalized in 512 districts. I was closely associated as the project director of DISNIC program in 512 districts. And then it is in 2010 to 2012 is the second major government of India program to go down up to 732 locations up to the block level veterinary offices, to network them to monitor national animal disease of the notified diseases, OIE notified diseases. And it was a very important program of the Department of Animal Husbandry and Dairying and Fisheries at that time. Now it is a new ministry. And it had a fantastic architecture. And the reporting system enabled block level, district level, and state animal health officials, and with the 7,032 locations with the BSNL's virtual private network on broadband connectivity. This was supposed to compile and generate animal disease information system for a whole country, and Food and Agriculture Organization and YI was eagerly looking for the success of this project from India. And we also saw to that the system server doesn't get hacked by any country which are exporting our the animal meat, animal products, and so on and so forth. And in the second phase, it was also designed to network to all the disease diagnostic laboratories. At that time it was 900, and also to bring out a complete decision support system, GIS enabled decision support system using artificial intelligence and and big data analytics, and also to network and also establish NADRS nodes on almost all livestock farms in the country, whether it is a private and public, and all ICR institutions dealing with animal disease, and state agricultural universities, animal husbandry universities, and so on and so forth. And also to network with the and that time there was a very big component, national e-governance in agriculture, NEGPA, that was one big component, livestock management system. Complete SRS was done and presented to the ministry. So I also recommended that NADRS and NEGPA livestock management system should reach the farmers through, and that time 2.65 Bharat Nirman Common Services Center, through mobile computing and issues flagged were value chain system for each animal disease from livestock farm to national and international nodes, development of advisory services using GIS technology, image processing techniques, and data warehousing and data mining techniques, establishment of NADRS nodes in veterinary colleges, veterinary universities, ICR institutes, disease diagnostic laboratories, KVKs, Atma centers, and also all milk collection booths in the country, and also in public, private, and cooperative livestock farms. A detailed brochure was made available on that time. And 2013, I got retired as Director General, National Informatics Center. And NADRS was supposed to facilitate citizen, block veterinary offices, and district veterinary offices, and state animal husbandry department, and all the stakeholders. Now Government of India, under the chairmanship of Dr. Praveen Malik, has announced NADRS 2.0, and also is operational during COVID-19 pandemic. And the government also is now working on One Health concept to practicality. And this has been announced. I'm very happy. On 22nd July 2021, there was a very strong stakeholders conference, and that has recognized that One Health ecosystem in the country is a platform where stakeholders need to discuss the challenges, the opportunities, the gaps, the traditional inefficiencies, the next steps, and the way forward towards the efficient and collective implementation of One Health initiative in the country. And then also it started and a pilot project in the state of Uttarakhand, as reported in the media on April 6, 2022. In that one, Dr. Praveen Malik said, "We are happy to move forward with the implementation of One Health framework in India. The pilot projects will help capacity building and understanding disease prioritization. 6 interventions have been planned for the implementation of the pilot. The implementations will cover institutionalization and operationalization aspect for better coordination amongst different reliant sectors. With the support of state departments and all stakeholders, we look forward to the successful implementation of the pilot." And there are a lot of animal husbandry startup India, and the Government of India also announced 2 challenges, grand challenges. One was held May 2020. Result was, it was announced May 2021, and now it is December 2021. Another grand challenge 2 has been announced, and the result also has been announced on May 2022. And I'm very happy. The problems which have been, the problem statements are very important. Cost-effective, long-term and user-friendly alternative for storage and supply of semen doses. Development of cost-effective animal identification and traceability technology. development of heat detection kits, development of pregnancy diagnosis kits for dairy animals, improvement of existing milk chain from value collection center to the dairy plant, and so on and so forth. And development of a low-cost cooling and milk preservation system and a data locker. And we also need a lot of startups in the health value chain to be built up from the grassroots level. And we also had recently a talk by Mr. Dr. Hegde, Narayan Hegde, former president of BAFE. And he is going to work with the university to establish animal husband, dairy startup in every gram panchayat, so that the milk does not go as a raw material, but it will go as a dairy product. It means that we have to work on a complete livestock startup at the gram panchayat level. And it is very important. There are about, as of now, 156 livestock tech startups are there in India. It has to go up to 2.25 lakh startups with respect to animal husbandry sectors are concerned. With this background, let us turn to the address by our guest speaker, Dr. Praveen Malik, Principal Scientist, ICAR, National Research Center Equines, and Animal Husbandry Commissioner of Government of India, to talk on Health Informatics Network Value Chain, National Animal Disease Reporting System, NADRS 2012 and beyond. This topic will motivate and galvanize the participants watching our telecast through facebook.com/Shobhit University India, or youtube.com/Shobhit University in, or linkedin.com/company/Shobhit University, for motivating them to get inspired to work through livestock tech startup at gram panchayat level, one-stop livestock tech startup to simplify supply chain and e-commerce needs of the livestock sector. With the aim to create a farmer-centric, technology-enabled ecosystem for livestock, the Ministry of Fisheries, Animal Husbandry and Dairying has launched a national digital livestock mission in October 2021. National Digital Livestock Mission is a digital platform being developed jointly by the Department of Animal Husbandry, Dairying and National Dairy Development Board on the foundation of existing information network for animal productivity health. And this is very important, and I also would like to seek that as to how these centers of excellence of the Shobhit University of Engineering and Technology deemed to be university, and the National Digital Livestock Mission, with a vast experience, which I personally, as a former Director General NIC, Deputy Director General Agricultural Informatics, and now Professor Emeritus and Chairman of the Center of Excellence, how we can contribute to the nation. We have Agricultural Mission Mode Project NEGPA document. SRS document is available with the Ministry of Agriculture. This is a comprehensive SRS document, should be utilized for the National Digital Livestock Mission. Next is that under the Agricultural Resource Information System project, we have even worked out on that time livestock resource portal. I will forward to Dr. Praveen Malik the framework which has been worked out, that how a livestock resource portal should look like, which was done by the World Buffalo Center, was brought out this, as an outsourced activity. And India has got about 2.25 lakh gram panchayat. These are all our problem statement. And we would like to introduce our guest speaker to the participants, Mr. Manish. Dr. Praveen Malik is presently working as a principal scientist at ICAR National Research Center on Equines and holding additional charge of Animal Husbandry Commissioner, Government of India. He had graduated in veterinary sciences from GP Pant University of Agriculture and Technology, Patnagar, and earned a PhD in veterinary microbiology. He is the recipient of fellowships of reputed National Academy of Veterinary Science, India, IABMI, ISVIB, and IVA, and honorary fellowship of MSI. Dr. Praveen Malik has more than 28 years of research experience as veterinary microbiologist on animal diseases. He had worked on surveillance of diseases in free-ranging wildlife, salmonella, isolated from foods of animal origin and their cytotoxic, enterotoxin, cytotoxin, detection and containment of glanders amongst equines, surveillance and monitoring of equine infectious anemia, and other bacterial diseases like strangles in equines in India. Sensitive and specific diagnostic for glanders, indirect ELISA using recombinant proteins, EAA, indirect ELISA, and acid using recombinant protein, and Salmonella, abatus eq, OMP based lattice agglutination test, as well as an OMP based vaccine candidate against Salmonella abatus equi in equines were developed under his leadership. He has also worked as an in-charge veterinary type culture collection, a repository of microbes of animal origin. As directors, Chaudhary Charan Singh National Institute of Animal Health, Dr. Praveen Malik was instrumental in reviving the institute, responsible for recommending licensing of veterinary biological in the country. His research interest includes infectious disease of livestock and wild animals, including the diseases of zoonotic importance, as well as advocacy and implementation of One Health. With this, I welcome Dr. Praveen Malik to the international webinar series on open source digital technology for self-reliant India to talk on Health Informatics Network Value Chain National Animal Disease Reporting System, NADRS 2012 and beyond. Over to you, sir.
Thank you, Professor Moni. Thank you very much for giving such a wonderful, extensive introduction to the topic, and also introducing me to the audience. In fact, you have made my task much easier by giving this kind of a background, which even I was not thinking of providing to the audience at this level. But then, yes, definitely that kind of thing, a platform which has been given by Shobhit University and Ardo together under the purview of this international webinar series on open source digital technologies for self-reliant India. That's like our motto of Atmanirbhar Bharat. And I'll be talking about the digital initiatives in the department, which started probably in a vigor from your side, from the department side together as NADRS at one point of time in the early of last decade. And now this has taken a shape, changed the complete system, and now we are moving towards digitalizing the whole livestock sector as such. So if I am permitted, I may share my slides uh, here, if you give me a minute. It will take a few moments. It's coming now.
No, sir.
It's coming, sir. It's processing.
Yeah. Let it come. You can talk.
So basically, when we are talking about this kind of digital, I should say a revolution in the digital world in the animal husbandry sector or the livestock sector in countries like India. Definitely, one big thing here, which I personally feel, is it's not an easy task when we are talking about this kind of a system in India, just because of many factors. One factor is just with the numbers, the size of the country, the geographical locations, and most importantly, our total animal husbandry sector is kind of unorganized in India. Bringing something which is already organized into a digital mechanism could have been very easy, but then you see the kind of population size we have got, like 500 million plus animals in all, leaving the poultry at one side. We have got a biggest population of buffaloes, total animal livestock production. Uh, and probably that's the reason when we have got the highest buffalo population, the highest total livestock population in the world. We have got a position of number one in milk production. We have got number one in cattle beef production, goat milk production, and all those things. So it's like we are standing somewhere with the big numbers, and it's not only about numbers, it's also about the distribution of these numbers across the country. A big country with a varied geographical and cultural varieties. We are second in cattle population, goat population, visual production, pig industry byproduct, which we say in aquaculture, goat meat production. Third in egg production, sheep population and fisheries production, and fifth in the poultry production, meat production. And if you go by the statistics in the market, it's a 150 plus $billion dairy market in the country. We have got 18 billion market of poultry in India. Uh, if you happen to see the growth rate over past few years, in fact, when we are calculating our cumulative annual growth rate over past 5 years in one go, right now, if I just simply compare the growth rate of livestock sector with other sectors in the country, it is growing at a wonderful rate of plus 8% per annum. It's like even during the COVID and after the COVID, which has impacted most of the sectors, including the services sector, the manufacturing sector, which were growing at a wonderful pace of around 7.9, 7.8. This has closed because they have come down. And if you just talk about the overall agriculture sector for that matter, the growth rate was really very less overall, which also all includes the growth rate from the animal husbandry sector. It is around 2.5% right now as on date in India. So it's like we are growing. We have got big contribution. And if you see the contribution of this particular sector in the GDP, the contribution to the agricultural GDP is close to 30% now, which is around like 40% even in some of the states. And the contribution of the individual sector is around like 4% in the overall GDP. So it's like a good contribution, a good growth rate. So kind of we have got wonderful opportunities and potential in this sector to grow further. And we have got increasing demand of the animal proteins day by day. If you just see the demand by even like next 7 to 10 years, if we say by 2030, it's going to be almost double. So it's like we are increasing in population. We have got we require more resources as food for the nutritional and food security. At one point of time, we were just talking of food security. Now we are talking about not only food but also the nutritional security for that matter, and coming to that kind of a system. And to meet that demand, we need to actually organize my unorganized sector. The overall animal holding in my country, when we say averages, you just cannot believe it is around 2 to 2.5 animals per farmer. So it's like totally distributed, totally unorganized. But then we have to bring them together without changing the livelihood of those rural farmers or the animal owners in that area. So the only solution, what I feel, is the organization of the whole system in a digital network. So, if you just look into various pillars which actually make the total livestock sector a completely a good solution to these issues of food requirement, nutritional requirement, and including One Health, as Professor Moni has rightly said. We need to understand, we need to have a proper health system, and in this, probably the disease reporting is a very, very important factor. And if you come into the disease reporting system, we have got certain issues. Definitely, with such a large country, with such an unorganized system, we are bound to have these kind of limitations, which is if we say the reporting is neither timely nor complete. So means that the compiled information does not represent true picture of the disease situation at any given point of time. So we need to have that kind of extrapolations and have those kind of physical interventions at times to get the real picture of those things. So it's like a difficult thing to understand, and probably the background reason for this is the inadequacy in the availability of the veterinary service in the country. We have got a wonderful network of veterinary services, largely government or the public funded, and we have got around 72,000 veterinarians present in the country, and of these around 35,000 are already engaged in the government sector directly, plus few of them in academic institutes, in the research institutes, in the private bodies associated with functioning of the government. So we have got good number of people. We have got a wonderful network of veterinary services throughout states. It's a state subject, so each state has got its own wonderful network, not only of the primary functionaries, but also the small laboratories. But then we have definitely have got inadequacies, and we are meeting them out through supporting through the mobile services. Now the government of India is doing with 100% funding support from here. I'm going to come to that point later on. And then the another part is when we are talking about the animal disease reporting system. So it's like lack of intersectoral information sharing. It's like we need to understand that we have been talking of One Health. We have been talking about the health of planet as a whole. Like if you change one factor in the whole ecosystem, it's going to imbalance everything. So we need to have information shared across these sectors in real time, so that we can take appropriate decisions as responders and as policymakers at the same time. We need to understand what is happening in forest. We need to understand what is happening on the human side. We need to understand what is happening on the livestock side, fisheries side, and all those sectors for that matter, so that these kind of things. And this all is possible if we have got a robust computerized system of animal disease reporting, that is the animal health. And this has to go to the last mile stakeholder as a professional, or maybe as a farmer. We are talking about these kind of solutions now, but before that I'm going to just talk about the kind of history. Already Professor Moni has very nicely introduced about the starting of NADRS, that is National Animal Disease Reporting System, way back in 2012. He developed it, and in February 2013 we launched it throughout the country nationally. But the primary focus at that time, just see that focus here, and I'm going to come after a kind of few slides to my National Digital Livestock Mission. The focus, the way we have changed our focus also in this initially, because this is the first starting, a big starting in the animal health reporting system, is the generation of primary data for effective disease control strategies. And this data can then be used to declare the disease freedom status, to detect emergence of new diseases, to talk about the zoonotic diseases. At the same time, we need to discuss on the risk analysis, risk management, risk mitigation strategies for smooth international trade also. And we have got the obligation as a member country to report to the World Organization for Animal Health. Only kind of like 10 days back, they have changed their acronym from OIE to WOAH. So it's like World Organization for Animal Health. So OIE, we need to, as a one of those 180 members, India is one of those primary members and has the obligation to to share our data with the transparency to these, so that it will actually add to our international trade, the export potential of the country, and we have better market accesses across the globe if we report in timely manner, and we have got these kind of systems directly from the last mile professionals coming from the field. So we have got different systems. One is the National Animal Disease Reporting System, which is the baby of Professor Moni, I should say, because he started, and the enthusiasm, I know I had been talking to Professor Moni at that time. We had lots of discussions on how this can be initiated right there from the field, and can be conjugated in a very meaningful way with the laboratories. We have got an obligation and a reporting system called WAHIS, World Animal Health Information System, under OIE. And this a specific department called WAHID in the World Organization for Animal Health is taking care of this thing. This has been revamped over years in a very meaningful way, and now lots of information, lots of analytics actually has gone into it. And basically this kind of a reporting system, now we need to understand how we can connect our NADRS to WAHI, so that this can the information can flow seamlessly, smoothly. Right now what we are doing is we are collecting information either physically or through NADRS, and then generating information as per the formats of WAHIs, and then transmitting them in that particular format. So it needs to be a kind of seamless system which is compatible with all those things. So we need to understand that these kind of a real need. And it's not only at the level of national or the federal level, it's also at the regional level first, because the commonest geography which we share with other countries is our neighbors in the South Asia. So say if we just name the association SARC, those countries have got the closest, and probably as per the international simulation reportings, we are considered as one of the important hotspots, though I debate on that personally, because for last 100 years we had seen lot many outbreaks and lot many pandemics from different areas, and nothing has been seen from that part of country, the region, world, that is South Asia. Minimum has come. Most of the things are coming from East Asia because of their feeding habits. Most of the things are coming from China and other places. But definitely the kind of population dynamics, the kind of population density, the kind of human interaction, the kind of wildlife interaction with our population amongst these three sectors, probably we are vulnerable to these situations. It's very difficult once it enters our place. But then if we have got these kind of systems and real-time sharing, probably this will help us understand the whole situation. And then there was a system with the Indian Council of Agricultural Research called ADMAS. This is Animal Disease Monitoring and Surveillance System. We have got another system on the uh, forecasting of disease. This is called National Animal Disease Referral Expert System, NADRS, with ICAR, National Institute of Veterinary Epidemiology and Disease Informatics in Bangalore. So what they do, I'm going to come in a bit detail later on. And then we have got a focal point of SARC epidemiological network. This is for the disease reporting on a regional basis. So what I'm talking about a national informatics system, I'm talking about a regional informatics system at the same time, and then the global network system at WISE. So it has to be a seamless process, so that we start talking of the federal system from the states, coming to the national level, coming to the regional level, and going into the global system. So if we start talking about NADRS, Professor Moni has already introduced this system, which was formally launched in 2013, and it went into all 7032 nodes. It's like plus 7,000 nodes throughout the country, which have been provided with all computing systems, all networking systems, kind of internet accessible through our government BSNL. and this was working through VPN access on broadband. So these functional units need to report not only the outbreaks specifically, but a system was developed to actually report all the registers, means the daily incidents, what is happening in what area on a daily basis. They had to report to their vaccination campaigns on a daily basis. It was a huge system, but then the kind of workload that has been entrusted upon the veterinarians in the field, they were already overburdened, considering the size, the population size, and the kind of dynamics. Plus, additionally, if we say you have to provide this kind of thing, they were actually they bound to have some kind of gaps. But then the objective was to have instant alerts to prevent revenue losses due to this animal health management, to disseminate the information related to animal diseases in all stakeholders which are relevant. Either they are the primary responders, the secondary responders, or the kind of policy makers, or that kind of thing. Plus all kinds of management related personnel throughout the system. It was meant to systemize the existing record keeping procedure, and I told you, if we go into the physical management of this system, it's going to be very, very difficult. I tell you, we're talking about 500 plus million animals, plus say something like 9,000 million, 850 million poultry birds throughout the country, and that too in an unorganized sector. It's not really very farm based approach. It's a small farms which we are keeping. Then to reduce the workload under manual system. But then what we could understand over the years, it was meant to do this, but then it was addition to the manual system, because we could not do away with the manual system. So it is like we wanted to convert to the computing system directly, but then the people used to system used to write everything in their registers and then shift their focus from the manual to the computing system. So uh, this is the quality of information we wanted to have, with more speed, more accuracy for the disease dissemination. We started this program in a big way. We started getting good results. Almost at one point of time, around 4,000 nodes were regularly reporting. But then we had issues in replacement of those infrastructural requirements, the computing systems, the personal computers, and their related internet connectivity to them. So we had those issues at that point, and then it started reducing in number. At that particular time, if you see the overall structure, this was integrated with livestock census, this was integrated with the district level informations, and this was having automated systems of disease reporting through IVRS, SMSs, emails, and web-based systems. So it's like it was actually and capturing a lot of data, including the GIS-based detection system, including like the location, the kind of movement it has got, and then the analytical system was using business intelligence tools, as Professor Moni has rightly said, that they were using all types of resources in the computing system. How it was operating, basically it was being monitored through a central monitoring unit at the Department of Animal Husbandry, and then we have got a state monitoring unit at the state headquarters there, and district unit basically was there. So whenever there is some information collected either by NGO, local bodies, farmers, veterinary practitioners, stockmen, sub centers, or whatever source, they used to reach these veterinary dispensaries or hospitals in physical format, on phone or whatever mechanism, and then they were transmitted to the block veterinary hospital for reporting. From here, this is the node of these 7,000 nodes. If you can see my arrow, I don't know whether you are able to see my arrow which is moving. So this block veterinary hospital actually reports online through this NADRS to the district unit, and they have to validate this information, will go to the state, they have to validate again, and then it will go to the central. But as soon as the block veterinary hospital reports it to somebody, it is seen by all district, state, and the central unit. So the purpose was something was happening. We have given specific timelines for that particular reporting and validations. So this was happening. Then these two areas were also linked to the district laboratory. Dr. Moni has already indicated that there was a module which was connected to this particular NADRS at the district level. The district unit was also having connectivity with not only with the district laboratory but also at the state level or the veterinary college level laboratories, and they have got a connectivity from the regional or the national reference laboratories, mostly with DHD and ICR system. They are having a wonderful tertiary laboratory structure. We have got this here. So they were feeding this information here, and at the same time, we are missing one arrow from regional laboratories to the central monitoring unit. It is also there, but these laboratories are also feeding the information in this, and it is available to us in this. So the information flow, which seems very complicated here on papers and on real world, it was made very simple through the application of NADRS at that particular time in 2012-13. But then we have got the challenges. The system was getting old, needs replacement. Lots of money was required. We faced many connectivity issues, and this daily incidence report is basically copying down the whole register of the whole day into the system. It's like doing something manual first and then replicating the whole thing into the computer system had become really cumbersome. And then updating the villages as per the local government directory codes, which is LGD codes maintained by the administrative departments of the country. So every time some villages are there, but then they have got hamlets. Some more hamlets have shifted to other places. New villages have come up. So these kind of things, and then updating this in the system at a national level. If you can imagine, we have got blocks of like that kind of quantum of 7,000, plus they have got like hundreds of villages under each of them. So we have got lakhs and lakhs of villages in the country, and if something changes in some place, to actually in real time changing this is also a challenge to us. Based on these issues, based on these challenges that we faced during this particular time, we started thinking about reorienting how to get more and more from this particular thing. So what we did on the basic platform of NADRS, we modified the data entry software to make it more user friendly, so that more things can be captured, and the fish diseases were added to this. We made it simple. We made it actually compatible with WISE. We made it compatible with the expert referral system, which is NADRS with Nivedi. And then based on that, we converted this PC-based system into both PC and web-based application, a mobile application. In this, I'm going to show few glimpses of that. And this was hosted later on in the NIC cloud as the part of Digital India program in 2019 itself. And basically, from there, we started looking at the revised first information report, which is the outbreak reporting, the DI cases, which is kind of a simpler version of the original DI reports, the vaccination, which has been modified to give whether it is a kind of mass or carpet vaccination or is a kind of responsive ring vaccination. And we have provisioned the fish disease capturing in this module in that. And then sharing of this information with NADRS of Nivedi, sharing of this information with the IDSP mechanism, Integrated Disease Surveillance Program of the human sector, which is now into IHR, Integrated Health database of this. So this complete system was meant to have better information sharing in real time, having user friendly approach for the farmer, for the ones, the data entry operators, including the professionals at the field level. And we also included the provision to upload some pictures in the disease incidents while reporting, so that whenever something is there, maybe they may not be capable of diagnosing it accurately, but then we have got experts in different places. We have got the image comparing softwares available. So probably this could have added, and this was one of the thinkings in adding these services, so that we have got better understanding of the first information of the outbreak in the country. And then capturing the information on the animal health camps also conducted in the campaign modes. Lots of such camps for collecting the information and also providing services to the farmers have been conducted throughout the country. So those informations, the transactions which are being done during those camps in a campaign mode, they were also captured in this particular, which was missing in NADRS 1. And the kind of vaccination targets and achievement was kind of to monitor the overall vaccination or the immunization programs in the largest populations of the world. We needed this kind of a software. These are some of the glimpses how this looked like after this was revamped. This is the offline, and this is the dashboard which we used to see after we log in at a block level, and the district, this one. And for that matter, these blocks or districts or the state, they were captured by virtue of their position when they are entering. Means you need not to say from where you are reporting, you need not to say which village you are into now. So it's like an automated system. But then capturing each information every time about the animal was a challenge, because this information was fed last year, this information was fed last month, this information was fed last week, maybe yesterday, and we are feeding it again here. So again, it had some issues. These are the pictures or the screenshots from the mobile applications. We used to have similar dashboards here, and accordingly, if you enter, this is quite. And we made it kind of a drop down understanding, so that no spelling mistakes and then matching issues with the software. So we had lots of information filtered through. If you say buffalo, the diseases for buffaloes would only be filtered through, and you have got very limited number of diseases, and area wise accordingly. So we have put in lots of filters and other things. So this is how the total animal disease reporting system was transformed into a mobile application also. Also, to introduce here slightly about the National Animal Disease Referral Expert System, which is a forecasting kind of system developed by National Institute for Veterinary Epidemiology and Disease Informatics of ICAR, where they have been working with Department of Animal Husbandry, Dairying and Fisheries at that time, and also Department of Animal Husbandry and Dairying right now, with their all 30 plus laboratories, their centers, which are reporting diseases directly to them, along with what we are getting. They have got good kind of data generation, not only through NADRS mechanism from us, but also their own mechanisms. They are also aggregating some information on climatic factors, integrating this data into different risk categories, and they start issuing the forewarning information, which is circulated to the states concerned, and the center for taking definitive answers or responses to that. This is how it looks like. Starting with data collection, which is the AICRP centers called Animal Disease and Disease Monitoring and Surveillance Centers. And they collect climatic data, the meteorological data, and from this get into the diagnostic and prognostic tools of the system. Means they clean the data, annotate it, realign, and then store accordingly with security. Then the processing will be there for the forecasting, And based on these forecasting, some alerts and warnings have been issued not only in the form of the written documents, but also goes as the advisories to the system. And they can be from no risk to the very high risk. And in forecasting, they have been using initially the statistical tools based mathematical modeling simulation models, but then they started also using the artificial intelligence, machine learning, deep learning, statistical models, model evaluations, assessments, and predictions of these things. So based on this, the warnings were issued. They were disseminated through web application, SMS alerts also, and some of those mechanisms. The responses from these AICRP centers, All India Coordinated Research Project Centers, the advanced centers where I was referring to see that the forecasting done here actually has happened over that time in that area or not. And from this response, they were looking whether the forecasting was correct or not. So there's a kind of through this feedback, it's a kind of validation of this particular forwarding as well. So it's a wonderful mechanism. The biggest problem here is, as such, the system looks theoretically very good, but the problem here is the quality of the data, the initial stage. If you if you just dump in something, you are going to get dump out on the other side. So we need to understand that to provide good quality data, we need good robust mechanism at the beginning itself. Means the NADRS system, which I was talking about in previous slides, and this system has to join hands to have good quality data and to provide that kind of a system. Then this is the kind of, again, a different pictorial depiction, how they used to have feedbacks, how they used to have the initial data, and how they actually generate the spot maps for those things, and generate the forewarning systems. What kind of information they were collecting, starting from the livestock population to the soil parameters, to risk factors, the syndromic data, the disease data, the meteorology data, the remote sensing data, and all those data as input, and then accordingly train their neural networks to get into a kind of forewarning mechanism as a model. So this is how they have been doing. This is the kind of monthly reports they are generating in this format, indicating in which area, in which district, what diseases. They are talking about 13 diseases right now, but if we provide better information on more diseases, they'll be able to provide better solutions or forewarnings to these diseases also. So this is how this looks like when they generate it. And this is the example of Karnataka, anthrax in Karnataka in April 2022, the most recent ones. And probably some of the districts, they say, are at very high risk because they had few cases of anthrax in last years. So this kind of thing. Apart from that, we have got many other initiatives from the department in the name of one app. We call it eGopala. Is the digital platform for farmers for providing access to different services. It's not only about getting information of how they have to feed their animals, how to balance their ration, how to reduce the methane production by having those mitigations through the nutritional interventions. So it's like an information tool, which is kind of a two-way information. But at the same time, in some of those, it is one-way tool to make them understand where a particular kind of productivity solutions are there. We have got apps within this eGopala, like Pashu Poshan, which is animal nutrition, Ayurvedic veterinary medicine. It's an ethno-veterinary approach to treat or to mitigate some of the local issues. My Pashu Aadhaar is the unique ID which we are now using in the new system also, which was the enough mechanism, which I'm going to cover right after this. And the most important one is Pashu Bazar, the market for not only the semen or the embryos, but also the live animals available to the farmer. So they can access where this particular semen of this particular breed, this particular embryo, or this particular live animal is available for sale or purchase for that particular farmer. So this is about, like, it's the total orientation had changed from the policy maker centric, kind of government centric, to the farmer centric approach of the total digital intervention in the livestock sector. Lots of things have already happened. Professor Moni, if I go beyond my allotted time, kindly let me know.
No,
I'll
no,
just.
please. No, 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 no. No, it's very important talk. You know that. No, you please carry on.
So thank you very much. Another initiative which we started was e-Pashu Heart. This is Pashudhan is livestock, so this heart is a market. So we started with this, but then this was converged into e-Gopala at a later stage. But then this was there for e-trading of the livestock germplasm and other related services. In fact, this e-Gopala, the last one also, let me just say, if you want to get into one AI service for one farmer, they can actually look into not only the availability of the semen, but also the availability of the technician, the name of the technician, the phone number of the technician through this app, and they can directly contact from this app that particular technician to deliver services at their doorstep. So it's a very, very important thing that this e-Pashu Heart thing is actually connected to this one, and this will connect farmers with breeders, maybe central, state, cooperative, or private agencies directly, because the database is maintained there. This is real-time authentication certified information on availability of germplasm and centralized repository of information of these kind of things. So it's like if you have got the portals like these, and you actually get the delivery of the services right at the doorstep in systems like ours, where we have got a wonderful network, still not adequate to serve the farmers at the last mile. Probably these kind of resources in the digital format would be very, very helpful, and these have been connected to eGopala at that stage. Another big initiative which started a couple of 4 5 years back, but then in 2019, when we started our the globally biggest program of immunization of FMD disease, against FMD disease for cattle, buffalo, pigs, sheep, and goat. Also, we are thinking in a strategic mode. So it's like targeting 500 million animals twice a year, injecting them with something, and then keeping their records. So we wanted to generate the kind of individual record for each animal. So what we started with is generating unique identification number to each animal in the form of ear tag, with the complete database of that particular animal at a central database called INAF, Information Network for Animal Productivity and Health. We used to collect all information starting from the pedigrees, the lactation, the owner, the breeding, the health, the nutrition, and whatnot. So it's a big database. If you once just feed this information of this animal along with the owner's information, the animal's information, and the location, this one. So you just need one number to uniquely identify this. This is the number given was as per the International Committee on Animal Recording System. So it's ICAR based uh, 16-digit ID, which was basically converted to a 12-digit, leaving the 4 digits of the country right now, because we know we are in India, it's administrative boundary. So we are using these 12-digit codes to each animal, which is unique, and we are actually keeping these new total records of whatever mechanism for all these animals. We can trace back the disease outbreaks, the disease patterns. From there we can actually look into the more productive, more healthier animals. Through this we can have better traceability. We can use the AI services, and just in a lighter mode, we started AI long back, when even before the AI from your side, Professor Moni, was discovered. Means we are doing artificial insemination before the artificial intelligence comes. So now we are using AI for AI. We want to use this artificial intelligence even for better delivery of artificial insemination services, because lots of startups have come up with the mobile based
just
applications where
just
they
to
can.
set in Dr. Malik, just to set in lighter vein, you work on AI for AI. Another slogan is AI for AI. This is AI for artificial intelligence. Another one is AI for agriculture innovation.
Absolutely. So these are going in one direction. So what I was saying is we have started using in the field some AI guns for insemination, which are equipped with the cameras and the applications which can in real time send you the picture. And even if the veterinarian expert is sitting like 500 kilometers or maybe across the globe, they can see the picture and say what are the issues with this animal, and can you inseminate, whether it is the right time for insemination, whether it is the right place of insemination. So you can drastically improve the conception rates and the breeding potentials of those animals using the AI services or the digital services in the artificial insemination. Similarly, the ration balancing, it's very important, because most of the breeding potential which has to be realized is through the animal nutrition interventions. And if you balance the ration properly, we will reduce the production of methane, the greenhouse gases from the livestock, which is a big issue at the international level, considering our the number of livestock we have got. And then we can monitor and follow the genetic improvement program. We want to enter into, and we are on the verge of entering into genomic selection, where we can actually shift from our progeny testing programs, which takes maybe 7 to 10 years, and then to improve systems in another one. We are now utilizing generating the genomic chips based on the SNPs, single nucleotide polymorphism, for the Bos indicus animals are indigenous animals, which are very different from Bos taurus or the exotic animals like Holstein Friesian and Jersey. So it's like we are developing our own technologies to meet our system, and then using this for the genetic improvement. We are using systems for the better nutritional interventions. We are using this for delivery of the services for breeding, like artificial insemination. We are using for tracking health records. We are using this information for tracking the outbreaks also and keeping the records. So before actually this system was developed, everything was kind of manual, and it was very difficult to reach out to all of those people. So we are getting into this one. Even in the IT sector, there's the livestock census. We started using the IT, and probably first of its kind. My 20th livestock census, which was conducted only in the digital mode. No paper was involved in the whole livestock census, which is kind of collecting information on lots of parameters on, like if I add the poultry and livestock, is like thousand say 350 million livestock and poultry heads, with use of tablets and computers through the cloud-based server developed by the by your organization, National Informatics Center. So it's a big one. So the complete thing was done on this, and this was done on like 265 million households, and around 4.2 million non-households, they have been surveyed throughout the country. So this is a big initiative which we started. Now it's very easy for us to have this kind of thing. Similarly, for the integrated sample survey to come out with the productivity models in the country every year, we have got major livestock product surveys for milk, egg, meat, wool, and all those things. So this has been done through another computer assisted personal interviewing, which is CAPI, which is done for this one. And this ISS, the integrated sample survey app, is named as ELIS 2021-22. This was done with the help of ICR, National Center, this National Agricultural Statistical Research Center, IASRI. So they developed this, and we are now using this in our system for the online collection of information. And when it comes to like these different interventions from these different areas, initially we started with NADRS. We also did something on forewarning in NADRS. Then we went into enough e-gopala, e-pashuhat, kind of the individual modules. Now we want to actually bring everything into one ecosystem. Now we want to generate it as a complete ecosystem, and the architecture. We take it as a mission for actually transforming the whole livestock sector into the digital sector as such at the national level. So this is end-to-end digital architecture for the whole sector. And the ecosystem design thinking. This was done by groups like iSpirit, other private sectors like Vadwani AIs and others. And this has been done through the help of big IT services like Tata Consultancies. These people were involved, Professor Moni, you must be knowing, into the Aadhaar card mechanisms, the COVID, the largest human immunization program against COVID-19 last year. So they have been into the government systems where we are actually looking into it. With the support of NDDB as our partner who is running this program for us, with direct interventions from us in all issues. We are just not talking about the breeding or the disease or the traceability, but we are now building in the accessibility for the loans, insurance, the interfaces with markets, the subsidies provided to the farmer in terms of e-rupee, the e-vouchers, which government has already announced last year. So we are building solutions based on AI, ML, and also the disease modeling mechanisms, which are very, very specific. The disease modelings were not used previously in the animal sector in India, but they have been very successful on the human side. And specifically, we have seen a wonderful use of disease modeling system in the COVID-19 outbreak. So over time, this model, we want to see this model as a sustainable model. And if you see the right side of picture, we want to collect this information as a unique ID. And you will be happy to note that we have covered almost 100%, bearing few lakh of animals, means we have already covered around 98% of this ear tagging with digital this one, and captured the data in the central database. This will serve as the basis. It means we will be utilizing the platform of enough as such. We'll be revamping the overall enough. This is there with the farmers. Now the farmer has got their numbers and they have got apps available with them. So if they want to report something about their animal, they want to take some help from the sector, from the government, through their unique ID, they simply have to say, this ID needs some help. And the frontline workers, the veterinarians, the call centers, the farmers, all those people here, they'll be generating information. They'll be actually putting in right kind of information. If they farmer says we have got a problem, the veterinarian will go there and say this is the solution to your problem. So everything will be fed in the PC, and there will be no paperwork, no hospital recording. So there will be no duplication of efforts from the farmers or the veterinarians for that matter. This information will get into the overall the data system, which is through open APIs based system, is cloud based information system. Data standards will be set up, federated architecture will be set up, and based on this data analytics, we'll be actually looking into this. We have got markets, we have got government agencies, we have got field vets, we have got farmers, we have got different agencies working around, NGOs, we have got the private players, private clinicians also working. We need to see that the system should be interoperable, and this feature has to be there across various applications. Even if I am doing something for extension in my part, I should be able to have that kind of information on the unique ID from animal, and can reach out to the farmer, to the government agencies, and that data can then be fetched to my system for better analytics and all those things. And it seems a reality the way we are progressing now. The design development of the overall stack is in progress by the Tata Consultancy Services, which is expected to complete in next 6 to 8 months. Pilots have already begun in Uttarakhand and Karnataka. We are doing. Apart from this, the laboratory modules have already been introduced for one disease, for the surveillance of foot and mouth disease, which is the most important disease for us, across 30 plus labs on the national level. So this pilot has already begun on ground, and we started feeding this information directly from the labs, from the field, into that system. See, I'll give you a very unique example here on FMD, the way it operates. The sampling frame is developed by our institute, which is specialized in disease informatics, is Nivedi. So they provide the total sampling frame up to the village level. It's a double stratified sampling frame. See, this particular frame is given in a particular format. So this particular the module can capture directly that sampling frame right from Nivedi. So it's already available. This is also available to the field veterinarians. So they collect this information, the sample, and send this information along with this sample to the laboratory. It's very easy for them now. They have to simply indicate the number, unique ID, and say this is the sampling frame I am referring to. The laboratory has got very easy task. They have to simply align those samples into their plates in that format. It's already there. So they see the map, they align this on the laboratory, they conduct the test, and simply from the machine they say, please capture this information. Once your basic information, the basic values are captured from the machine, it is already fed into the whole the reporting, the calculations, the analysis, and everything is done by the machine. So the laboratory personnel has nothing to do beyond that. They'll simply say, this is my information, capture this, and thank you very much. The information will automatically flow from the worker, laboratory scientist, to the lab manager, to the state, to the central level, at the central monitoring unit at the government agency. So I'll get the real-time information on my disease surveillance and monitoring. I'll get the real-time information what is happening. So my time for response will reduce drastically. So it's a big unique change. And procurement of cloud space and migration is planned over next 2 months for this enough also, where we are just building. So it's like a development of the overall system. This is the overview how NDLM will work. But then if you go into the details of this particular digital architecture, this is the way we are working. We are not talking about the PCs. We are talking about different mobile apps, web portals, voice interfaces, ICVRs, chat boxes, SMSs, and the kind of information we are developing either from frontline workers, or the data entry workers, or the call center operators. Something like if you call a mobile veterinary unit for treatment of your animal, you have to say, my animal number is this, I've got issues. Can you just check up? So the data entry operator will actually, they open the call with this unique ID. Everything will be fetched from the enough database, and then he'll have lots of information about the complete animal, the owner, the location, and all those places, and the phone number also. And at that time, the call center can write, you can write in your app, you can actually call through ICVRs and can be recorded over there. And this is open call for the veterinarians or the responders which are available in the veterinary unit of the mobile. They go to that particular place, look into it, give the tentative diagnosis, and close this call. As soon as you close this call, the job for the veterinarian is over. He does not require to have any other manual reporting after this. Everything will be captured in this and can be seen by different stakeholders in real time as per the permissions given in the system. Similarly, for the breeding, they simply what we are planning is right now what we are doing is enough entry. They are doing AI and putting the entry right there. Now what we are planning is to have just the capturing of the barcode which is there with the unique ID, and also capture the barcode of the semen straw, and that's all the job apart from the physical artificial insemination done by the veterinarian or the paravet. So everything is captured about the parameters of the bull, everything is captured about the parameters of the dam, and everything is recorded. And if you have the pedigree record, you can actually have the PT values, the progeny testing values, the breeding program improvements, and other things. So similarly, we have got the procurements of milk and meat, maybe through cooperatives and private ones. We have got the laboratory hospital system. We have got the vaccine supply systems, the vaccination implementation programs, the cold chain maintenance, and all those things, the breeding systems, and the disease surveillance and reporting system integrated into this one digital architecture, what we are talking about. So through this API gateway, we will be actually doing these informations on these different things, from up to from data reporting to information analysis, and after this analytics, the final outcome in terms of what is required to be taken as action. So this is the complete architecture what we are talking about, and this can actually unlock the real potential of multiple priorities of this sector. What we have been talking about, the biggest sector with lots of potential, probably we can talk about all those things. And one of the biggest low hanging fruit is the traceability. You have already touched upon, Professor Moni, on that when you were introducing the topic, that this kind of thing. And we have started talking about traceability. We start with the buffalo meat, we start with the poultry farm meat, and we can talk about milk also through the cooperative mechanism, which can then be extended to all other factors. And we already started developed a policy on this policy paper with the help of ICR's National Research Center on Meat, which is there in Hyderabad. So DHT in collaboration with that particular institute started working on traceability mechanisms, and that has already been considered by our NDLM team as well, where we have been talking about unique ID, applications, data infrastructure, and all those things. But at the same time, we will be talking about the direct benefit transfer to the beneficiaries at the last through e-vouchers in overall system. So this integrated NDLM is really a very, very important factor. When we have been talking about strengthening my animal health infrastructure. I'm talking about the green ellipse here, this circle, when we say it's cloud-based data structure. But then we have got the similar setup of IHR or IDSP in human side, and then we are working with the wildlife authorities in generating or coming up with the one national referral center for wildlife disease surveillance, where wildlife disease also will be generated. And this information right now is helped through my diagnostic labs in the animal husbandry sector. So these labs will also feed wildlife data. The referral center which we are planning now will also feed the data. Human disease will also feed the data, and probably we also feed the data to the same system. So there will be a real time sharing of this information at one platform, and we'll be talking about the disease specific zero surveillance. We'll be talking about environmental molecular surveillance like polio we had done. We will be connecting with the livestock live markets and abattoirs at the same time. We'll be talking about event based contextual data like media reports and others. So it's like everything will be fed, everything will be made accountable, and then all these players, starting from farmers, they'll be participation. They'll have a direct participation of this kind of a mechanism. So they have got their own say. They have got their own understanding about this, and they'll be kind of what I say, having the ownership to this particular program. So they feel more associated with this program. And then farmers with frontline workers to the laboratories to the government system, so everything will be connected through this particular mechanisms for this. And probably this will make the base for implementation of the One Health initiative which different departments are doing. Although from my department we have gone a step further in actually generating that kind of an ecosystem in the states, so that we start talking about how to institutionalize this mechanism, how to build the capacities of the field level workers, how to enhance the capacities of the laboratory for better diagnostics, how to go about developing better diagnostic tools. And also at the same time, we say the last one, but I say the first one is the communication strategy, the outreach model, how to communicate about these One Health issues with not only public at large, but also to start with the professionals itself. If we see, I know about One Health, but I do not actually implement it. My counterpart on the human side, my counterpart on the wildlife side, they also talk about, and I am hearing this One Health for last at least 20-25 years. And everybody, I am delivering lot many lectures on One Health, but then it is all concept. And then when we say One Health, right now, human health has got One Health, not only one. They have got One Health on the government side, One Health on the ICMR side, which is a autonomous body. We have got One Health in National Center for Disease Control. We have got One Health in National Biodiversity Authority. We have got One Health in ICR, One Health in the Wildlife Environment, Central Zoo Authority, Animal Husbandry Department. So how many One Healths we need? We are talking about zoonotic diseases mainly. What I am talking about is health. If you talk about, like, you must have heard Sadhguru visiting different countries, and of late he is talking about soil health. So if we start talking about these things on a common platform, one point being affected at one point will actually going to affect everybody, all alike. So what we need to understand is, when we generate some information on any parameter, for that matter, has to be shared at a level which is responsible level, and then we need to understand how it is going to impact the overall ecosystem, which actually has to be taken into account even before the disease incidence is there. So what we need to understand is, we need to act even before the disease occurs. So we need to forecast this. So I say there is a model called we need to predict, we need to prevent that predicted item happening, we need to diagnose it quickly in case it is there, and then respond it quickly. So this is predict, prevent, detect and respond model. It is really very essential, and for this we need better informatics, so that we can actually have the information flow in a very nice manner, and the forewarnings are also possible in a good way. So this is overall picture of this, and we are looking for not only services at one point, but we are also looking for the involvement of pharmacies. Say e-voucher is generated at the hand of the farmer, but then I don't need any AI. I have sold my animal, I want to use this e-rupee or e-voucher. I can go to a pharmacy and say, can you give me this thing for against this voucher? We have got FPOs which can play a very important role from these things. We can buy and sell these animals. We can actually generate some information on how the IVF program which we are running in the animals for increasing productivity is doing in the field. How responsive are the farmers through this mechanism? It's also about availability of the germplasm. And for this, probably this single front-end application will be comprehensive for dealing everything, which can be taken up as an open API source from different sources, and then updated eGopala for the farmer on this side, and we can have a special purpose vehicle also generated. So looking for how to have better funds flow for application of this thing. So to conclude, although I got a bit late in doing this, but then my conclusion or the epilogue here is that effective and efficient animal disease reporting system, they need integrated disease reporting system. It cannot go in isolation. We need to share all these among all the sectors, and that's why we need to focus on institutional capacity building at each level under one framework. We need to strengthen the diagnostic capacities also, so that the information will be really meaningful and can be believable. We need to strengthen the veterinary services when I'm talking about the animal sector, but then we have to strengthen the provisions of our services which are responders in the field, be it veterinary services for the animal sector, be it the health services for the human sector, or the wildlife disease responders as the forest managers. And this will actually be requiring scaling up integrated disease surveillance and strengthening community level disease reporting systems. Means the way CDC is doing, they say if you feel you find something like this, you can report it on my website. I am responsible for anything what you suspect, to actually confirm that at my level and do that. So with this, would like to conclude my talk here, and like to thank specifically Professor Moni in person and personally, before I thank the platform from Shobhit University and Aldo, which is an initiative from both CIDSA and CITSA. So thank you very much, Professor Moni, for giving me this opportunity and talk about the big initiatives which we are talking at the Animal Husbandry Department, the biggest animal immunization programs, the biggest digitalization program for digital initiative for this sector, the big programs for inseminations, the big programs for breed improvements. In fact, we need to consider few things like telemedicine we have been talking about, but then we need to keep the sanctity of Section 30B of the Veterinary Council of India Act, which deals with the kind of provisions, how much is allowed without the supervision of a veterinarian. If we say doubling the farmer's income, definitely these particular initiatives are not only help farmer double their income. My take is we can multiply the income by 4 times. We lots of startups have come, lots of innovations have come from the startups, and we are supporting them. In fact, you must be knowing the Empowered Technology Group, which has been constituted at the highest level from PMO, is taking this particular mindset into the government that the technology has to be utilized, and for this they have created one technology officer in each ministry and department. Whatever way, they say it's not only about using the technology for your programs, but also handling your day-to-day activity within the ministry and department. So it's like not only in my programs like this, but also something like we are talking to each other right now. Can you use these kind of platforms and systems, e-offices also? So that kind of mindset is there. One good example is when we are talking about doing ear tagging for unique IDs. We are also trying to come up with muzzle print based identification of each animal. Right now, they have piloted it for smaller solutions like insurance. They want to insure the animal, take the muzzle, which is very unique imprint, and then getting into if the animal dies, tag can be changed, but the muzzle print cannot be changed. So they are using this right now, and we some startups have already started using it. We are looking for a large quantum validations from these people, so that we start using this muzzle as an alternative to ear tagging if it is possible. So looking forward to these kind of simple things. But then applying these new initiatives of the digital technologies into traceability mechanisms, export and import of my livestock and livestock products, through the customs handling systems, my regulatory approvals for any importing, licensing imports, licensing manufacturing of vaccines and drugs, marketing. These also are being undertaken through a system. A portal has been developed by Ministry of Health under CDSCO, Central Drugs Control and Standards Organization. We are working with them because even veterinary vaccines are being handled by them. But then we are the people who have to provide them the policy inputs on all those things. So we are also developing that kind of online portal. So that kind of, and the biggest issue on all these things is the creation of the animal health committee called Empowered Committee on Animal Health by the department, ECAH. This committee is being chaired by none other than the principal scientific advisor to Government of India, and they have been we have been handling lots of issues pertaining to animal health policies under the purview of this committee. And under this only, the coordination of One Health initiatives by these different departments and ministries at one place is being what I say is the coordination job is assigned to the PSA, so that he can actually as a boss can actually coordinate all these individual efforts and bring them into one platform, so that more information is generated and more this thing. The biggest I say win to our generation or this particular movement is the political commitment for all those changes from the highest, I tell you, from none other than the Prime Minister. The way our Prime Minister is thinking about utilizing the technologies, talking about One Health, talking about the coordination mechanism on all those things, it seems a reality to come to that level, so that we can actually achieve the goal what we have got in making the country a real self-reliant India, Atmanirbhar Bharat. Thank you very much, Professor Moni. Jai Hind. You are on mute, sir. You are on mute.
Thank you very much, Dr. Praveen Malik ji, for your wonderful address today in the international webinar series on open source digital technologies for self-reliant India. We started to give a brief for another 2 minutes that I put the first proposal to the Ministry of Agriculture, then Secretary Animal Husbandry, in 1999 January on Animal Production and Health Informatics Network, APH Net, 99 and 2000. And the blueprint for
I remember, Professor Moni, we had VCs at that time talking about how this can be actually
and then
implemented.
95, I had the major conference at Vigyan Bhavan, and then the Union Minister for Agriculture, Dr. Honorable Shri Dr. Balram Jakar attended. We brought out 15 informatics network in the agricultural sector. This is the first time in the whole world. That's why I'm being called as a father of agricultural informatics in the country. Before that, 1987, as the project director for District Information System Program for 512 districts, I brought out 28 sectoral database development programs, first time in the world. And then, at that time, technology was not available. We were strong in information system. And I'm still alive from 1987 until today, 2022. But different things are taking place. But it saddened me that in such an important area which affects common man at the village level, even in 2022, to hear from you that One Health has been understood by many people in a different manner. So it means that people are understanding elephant the way in which they are able to look at an elephant. That we had a story. We used to, normally our teachers used to teach us how physically visually, disabled people used to understand elephant in a different manner. I wrote an article for an international conference in 2005. Rural India is a different meaning to different people. It's a very important talk. See, starting from 1987 with District Information System on Animal Husbandry, that is livestock, and then fisheries, and then fishnet and APH net in 1995, and then National Animal Disease Reporting System in 2010 to 2012, February 14th. And then and that time it was it was thought that National Animal Disease Reporting System is very important to bring in that the rural income to be and that time nobody talked about doubling farmers income. It is very important. That's how the then Secretary Expenditure approved this 110 crores worth of program at that time in the when the project was approved. But I wish that I didn't retire in 2013. If I would not have retired and I would have continued, and that the project would have seen much better the way in which this. Anyway, it is good that we had another important person like Professor Moni and the Dr. Praveen Malik to take the walk in a better manner. But the important thing is that I have been voicing that livestock informatics network value chain is very important. It is a value chain. It's more important for open innovation and value creation. And in that livestock informatics network value chain, health informatics network value chain is very important, which I have been voicing that. And then under that health informatics network value chain, animal health, soil health, and plant health, because the minerals in soil controls the systems, our cells of human cells, human metabolism, plant metabolism, and animal metabolism. So soil health is more important. If the soil is not healthy, we can't have a good animal health. We can't have a healthy animal, healthy water.
Nobody for that matter. No living organism without soil.
That's why I had a talk in the same webinar series that how to use artificial intelligence and big data analytics to ensure that nutrition, optimal nutrition in the soil and harvested food to reduce human disease. It's very important. And I'm very happy to have this talk in this webinar series on health informatics network value chain. It is a $1 trillion worth of data economy. I don't know whether our honorable principal scientific advisor understand this or not, but the thing is that it is very essential to get integrated, because we have to unlock the potential. The potential here are livestock informatics network value chain, facilitating open innovation and value creation network in the digitalized world for self-reliant economy, self-reliant India, to generate why only 2 times? It is 4 times, 10 times from the rural India. And rural India, as of 2012, the former chairman of Hindustan Unilever said it, that appropriate technology adoption in rural management can give $1.83 trillion to the then existing Indian GDP. Now you add, include the inflation, we can cross $10 trillion if we have an appropriate rural India management, adoption of technology. 6.25 lakhs villages. That's why I have been propagating that every Gram Panchayat should have an agri-tech startup facilitating agriculture and allied sector. Every rural youth, educated engineers, agricultural science graduate, through agricultural informatics, they have to be upskilled, upskilled and skilled, and entrepreneurship development has to be taken place. That's why the 5 centers of excellence of the Shobhit Institute of Engineering and Technology is working in the area of agricultural informatics and Industry 4.0 for SMEs and health informatics to bring in this overall informatics value chain in the country. But today, Dr. Malik Saab, I think your screen is okay, fine. It looks like the screen is frozen. You know, and I am very happy that by listening to you with the things which are now happening, that we have to undertake by joining with these centers of excellence and your office and National Institute of Animal Health and various other national digital mission on livestock mission. We have to bring in livestock informatics network value chain, animal the human health informatics network value chain. Having animal health informatics value chain is very important, and reaching to the animal resource farmer. That is the thing, is that the livestock farmer through this value chain is more important. And I would like to hear from you in what manner we can work together to bring this, is because we are all working for more than 35 years in this field. When nobody else was talking, I have been walking through the National Informatics Center in the grassroots level. And I would like to see the light of the day in the tunnel at the grassroots level with respect to the livestock informatics network value chain very effectively. Today talk is very important, and the health informatics network value chain, National Animal Disease Reporting System 2012 and beyond is very important. Hope that this is being understood by all the stakeholders who are involved in this NDLM. Very important. I will come and see you, discuss with you how we can network and associated with each other to bring in that this network value chain is established, connecting millions of animal resources. Rather than calling animal, they're all animal resources, and 6.25 lakh villages, and 14.5 crores operational holders in the country, because achieving sustainable integration of livestock with agriculture for smallholder farmer is the new India. If India is agrarian economy, this we have to do it, sustainable integration of livestock with agriculture, and for which the livestock informatics network value chain and animal health informatics network value chain, or health informatics network value chain, to promote one health and eco health is very important, for which we need to bring out lot of capacity building through agricultural in the informatics discipline, health informatics discipline, and very important. And I also would like to tell you that Nivedi name had informatics as a component is due to me. When I proposed it to the ICAR, then the Director General ICAR, is very important. I felt very happy to see that they had the type word, this is informatics. And we have to integrate together for the sake of bringing solutions to the advisory systems to the millions of livestock farmers in the country. And I would like to hear from you, final word, and then we'll close the webinar. Over to you, sir.
Thank you, Professor Moni. Very rightly said, we need to, first of all, make all the stakeholders involved in this whole, I should say, a movement. It's a big thing that we need to involve all the stakeholders. We start from the top, from the government, the political commitment to the administrative commitment. And fortunately, as on date, it's more than 100%. I'm very happy to see this kind of involvement from none other than the PMO directly, the principal scientific advisor, who is now changed, and the second one also, who has come after the initiatives were begin. He's also having keen interest in this. We could present this program to him, and because right now this is already ongoing program, so lots of efforts and lots of progress has already been made. My secretary, who has gone, who is kind of a path leader for this particular program, is a kind of like he is actually showing the leadership capabilities. This one, so a kind of involvement from the top is really making me very, very happy from that side. The way we actually have the feedback from the initial pilots in Uttarakhand and some of those, even the laboratory personnel are very happy the way this has been presented to them, and they started using it now. So it's like everybody has to be involved, has to show their willingness, and then probably in the initial phases, it seems we are successful, and then we have to make the field functionaries, which are the highest in number, to realize its importance. We need to take it with full throttle to these people, also having an effective communication strategy to make them understand the value of this particular thing. So the overall system is very positive right now, and with the support of the government, with the support of the system, state governments, I see that this will be a reality very soon, and we can take it further as animal informatics network value chain, definitely, and we can discuss further on this. And I would suggest to have another talk from Dr. Sindhura Ganpati. I was telling yesterday, he came to this place almost half an hour back, but then went into the BSL 3 laboratory of the institute. So he is just having a visit. So we can have a separate talk for him, or maybe you can have a discussion so that his plans, how principal scientific advisors office is thinking about the overall plans of bringing the different initiatives together for making the overall system as an integral system. So thank you very much, Professor Moni,
Thank
for
you very
inviting.
much, and I will also come and see you. And I'll tell you, we'll meet in your office, and also we'll have a discussion in the principal scientific officer, as
Right.
office of the PSO. And then also would like to meet the stakeholders. I will also would like to have meeting with the secretary, animal husbandry, where jointly both of us can go and see that how this is necessary, and they accumulated knowledge and the activities which we initiated from 1987 onwards till today, it has to reach the common man. And this is where I thought that, after my, after retiring as director general NIAH, I thought that I should spend my time on informatics development in this agriculture sector in the form of agriculture informatics, and for various, allied sector, so that, the rural youth can be trained. Officers in the state and central government can be trained on informatics discipline, so that that will be a mass, movement. This is very important. And
Absolutely.
because in
Absolutely.
the
This
year
is the
today
word.
technology is available, but the thing is that information system is not available. If the
Absolutely.
information system would have been available, interoperability would have been easy. And people, they have a sophisticated technology, but the thing is that, and we have been consistently forcing that, developing an information system, appropriate information system with building blocks, so that we can construct if the foundation is very strong, we can have an umpty number of stories above. And we can't develop technology based information system. We have to
Right.
adopt technology on information system. And today
Absolutely.
it is the other way around. And people like you, people like me, and let us sit together and see to that livestock economy is done. Digitally enabled livestock economy, let it convert as a digital platform economy in the livestock sector. With this, I would like to thank you, and let us meet frequently. Let us unlock the potential, and to bring in, and livestock sector is very important. Today, I'm very happy to have your talk, and let us have a value chain action plan to propagate it. And let me also, after the gap of 10 years, now let me get associated with your mission in whatever capacity it is needed. Thank you very much. Thank
Thank
you.
you very much, sir. Thank you very
Thank
much.
Thank you. So with this, we will close the webinar and leave the studio. Thank you very much. Thank you.
Thank you very much, sir. Have a good
Thank
day.
you. Thank you.